Ever feel like your mind goes blank the moment you pick up a test? Today, we're breaking down test anxiety, what it is, why it happens, and how you can overcome it. By the end of this video, you'll have effective tools to boost your confidence and performance on exams. Get ready to change the way you face exams forever. 1. Root causes of test anxiety. Understanding the root causes of test anxiety is crucial for developing effective coping strategies. Let's break down these causes into 3 categories: psychological factors, educational factors, and personal factors. Starting with psychological factors, fear of failure is often at the forefront. Many students worry excessively about not meeting expectations or not being good enough, which magnifies the pressure they feel. This fear is closely tied to past performance, where one bad experience in an exam can set a precedent that haunts a student's future test-taking ability. Perfectionism further exacerbates this anxiety, as the desire to perform perfectly can lead to overwhelming stress. Next, we consider educational factors. The culture surrounding high-stakes testing can massively contribute to anxiety levels. When significant consequences are tied to the outcome of a test, the stakes are high and the pressure mounts. This situation is worsened by a lack of preparation, which might be due to inadequate teaching methods, insufficient study time, or unclear testing objectives, leaving students feeling unprepared and vulnerable. Finally, personal factors play a critical role. Low self-confidence can make students doubt their knowledge and skills, affecting their performance. Negative self-talk, where students mentally tell themselves they are not capable or smart enough, directly impacts their emotional and psychological state during tests. Addressing these root causes through targeted strategies can help students manage their anxiety more effectively, leading to improved confidence and better test results. By understanding what drives test anxiety, students can begin to dismantle these barriers and approach exams with a clearer, more prepared mind. 2. Recognizing symptoms of test anxiety. Symptoms can manifest physically, emotionally, and behaviorally, impacting students' overall performance. Physical symptoms are often the most noticeable signs of test anxiety. These include excessive sweating, headaches, a rapid heartbeat, and even nausea. Such symptoms can disrupt a student's ability to focus and perform well during exams, as the body's fight-or-flight response kicks in. Emotional symptoms include intense feelings of dread about the upcoming test, panic attacks that can feel paralyzing, and in some cases, deep and persistent sadness or depression over academic performance. These emotional responses can cloud judgment, distort thinking, and make it difficult to approach the test with the necessary calm and rational mindset. Behavioral and cognitive symptoms are particularly detrimental to effective test preparation and performance. Avoidance behaviors, such as skipping study sessions or even the test itself, are common. Procrastination is another key sign, where students delay preparing for the test due to the anxiety it causes. Difficulty concentrating can make studying inefficient, as anxious thoughts interrupt the focus needed to process and retain information. By identifying these symptoms early, students can begin to apply specific strategies to manage their anxiety. Addressing each type of symptom requires tailored approaches to ensure that both the mind and body are prepared to handle the stress of testing environments effectively. 3. Immediate strategies to manage symptoms. When test anxiety strikes, having immediate strategies to manage symptoms can make a huge difference. Here are some practical techniques that can be employed right before or during a test to alleviate anxiety and enhance performance. Firstly, breathing exercises are a quick and effective way to calm the nervous system. A simple technique involves deep, slow breathing. Inhale deeply for 4 seconds, hold the breath for 4 seconds, and exhale slowly for 8 seconds. This method helps reduce the physical symptoms of anxiety like rapid heartbeat and sweating by triggering the body's relaxation response. Mindfulness and presence during the test also play a crucial role in managing anxiety. Simple grounding exercises can anchor you in the present moment and ward off panic. Focus on your senses, what you can see, hear, and touch. This practice prevents your mind from wandering to anxious thoughts and keeps you centered and focused on the task at hand. Preparedness is perhaps the most comprehensive approach to combating test anxiety. Effective studying tips, such as breaking down material into manageable chunks and using active recall techniques, can boost retention and understanding. Time management is also vital. Creating a study schedule that allocates specific times for different subjects can help avoid last-minute cramming, which often increases anxiety. Employing these strategies not only helps manage the immediate symptoms of test anxiety, but also builds a foundation for more confident and calm test-taking in the future. By incorporating breathing techniques, mindfulness, and thorough preparation, students can approach exams with a clearer mind and a more focused approach. 4. Long-term strategies for overcoming test anxiety. The long-term strategies for overcoming test anxiety is similar to building a more resilient mindset and acquiring skills that last a lifetime. At the forefront are cognitive behavioral approaches. These methods are not about superficial fixes, but involve a deep dive into how we process thoughts about testing. The goal is to identify negative thought patterns and replace them with more positive and realistic ones. This shift doesn't happen overnight, but through consistent effort, it's possible to change our internal narrative about exams. Regular practice in simulated testing environments plays a crucial role as well. This strategy is about more than just understanding the material. It's about becoming comfortable with the format and pressure of an exam setting. By regularly putting ourselves in conditions that mimic actual tests, we reduce the unfamiliarity and anxiety that can come with the real thing. It's practice not just for the content, but for the experience. There are instances, however, when self-help strategies might not be enough. Seeking professional help is a step that should be considered seriously. Acknowledging that sometimes the roots of test anxiety are deeper and might require specialized strategies and support to overcome can be revolutionary. Whether it's through therapy, counseling, or other professional services, getting help is a proactive step towards not just managing test anxiety but thriving despite it. Incorporating these long-term strategies into your routine can transform your approach to testing, turning a source of stress into an opportunity for growth and learning. 5. Technological aids to help prepare. A plethora of apps and online resources are at our fingertips, specifically designed to tackle anxiety and streamline study planning. These tools offer strategies for relaxation, such as guided meditation and breathing exercises, directly addressing the physical symptoms of test anxiety. Additionally, time management and organization apps help students structure their study time effectively, ensuring a balanced approach to preparation. Educational technology goes a step further by supporting personalized learning paces. This aspect is vital because it acknowledges that everyone learns differently. Adaptive learning software assesses your understanding of a topic and adjusts the difficulty level accordingly, ensuring that you're always challenged but not overwhelmed. This personalized approach helps in building confidence and reducing anxiety, as students feel more in control of their learning process. The benefits of integrating these technological aids into your study routine are manifold. They provide structured support, allowing for a more focused and efficient preparation. Moreover, by catering to individual learning styles and needs, they make the process of studying for tests less daunting and more manageable. Embracing these technologies not only aids in overcoming test anxiety, but also equips students with skills and strategies that benefit them beyond the classroom. 6. Creating a supportive environment. This is critical in overcoming test anxiety, and both teachers and parents play pivotal roles in this process. Teachers can design low-stress study sessions that encourage learning without the pressure of grades hanging over students' heads. Such an approach fosters a deeper understanding of the material, rather than just memorizing for the test. Meanwhile, parents can provide a calm study environment at home, along with reassurance and understanding. Recognizing effort over perfection and providing constructive feedback helps in building a child's confidence. The importance of a support network extends beyond the home and classroom. Peer study groups are invaluable resources. They offer a sense of camaraderie, allowing students to share strategies, clarify doubts, and learn from each other in a less formal setting. This peer interaction can alleviate feelings of isolation and stress, as students realize they are not alone in their struggles. Additionally, counseling services play a crucial role. Professional counselors can offer personalized strategies to manage anxiety, addressing the issue from a psychological standpoint. They provide a safe space for students to express their fears and frustrations, offering support and guidance tailored to each individual's needs. A supportive environment, encompassing teachers, parents, peers, and professionals, creates a holistic approach to managing test anxiety. It's about nurturing a setting where students feel understood, supported, and equipped to tackle challenges, transforming the testing experience into a more positive and manageable one. Now for our bonus tip. Progressive muscle relaxation, PMR, is a powerful technique that reduces stress and anxiety by alternately tensing and relaxing the muscles. It's a method that anyone can learn and practice, particularly useful for managing test anxiety. Here's how to perform PMR. 1. Find a quiet place. Start by finding a comfortable position in a quiet environment where you won't be disturbed. You can sit or lie down. 2. Breathe deeply. Take a few deep breaths to center yourself. Inhale slowly through your nose, hold for a few seconds, and exhale through your mouth. 3. Tense and relax muscle groups. Begin with your feet and work your way up to your face. Tense each muscle group for about 5 seconds, then relax it for 30 seconds. Notice the contrast between tension and relaxation. Move through your legs, stomach, chest, arms, hands, neck, and face. 4. Focus on the sensation. Pay attention to the feeling of releasing tension in each muscle group. This mindfulness aspect is key to the relaxation process. Practicing PMR before or during tests can significantly help in maintaining calmness. Tensing and relaxing muscles can lower the body's stress response, reducing feelings of anxiety. It shifts your focus away from anxious thoughts and onto your body, grounding you in the present moment. This technique can be particularly effective right before a test, helping to clear your mind and approach the task with a more relaxed and focused state. Regular practice can make it a go-to strategy for managing stress in any high-pressure situation. For more personal development tips, watch our video on the psychology of success, or learn how to stop negative self-talk for good. Thank you for watching. Don't forget to like, comment, and subscribe.